Good afternoon. This public forum is being put on by the Pharmaceutical Society of Jamaica to provide factual information about the approved COVID-19 vaccines. We want persons to willingly decide to take the vaccines, not based on what them hear say or what them see in a video, but based on the truth, which is based on scientific research. If you still do not want to take the vaccines, then that is your choice. But based on facts, not fiction. In following the COVID-19 protocols and taking the vaccine, you will help to save yourself and those around you. Now, our panel of distinguished guests are Dr. Winsome Christie, President of the PSJ, that's the Pharmaceutical Society of Jamaica. Dr. Winsome Christie is a clinical pharmacist, a lecturer at Utech, Jamaica, a naturopathic physician, holistic nutritionist, integrative health and medical specialist. Dr. Ernestine Wilson, immediate past president of the PSJ, clinical pharmacist and lecturer at Utech, Jamaica. Dr. Lisa Bromfield, past president, PSJ, clinical pharmacist and lecturer at Utech, Jamaica. Dr. Diane Newman-McKenzie, clinical pharmacist, lecturer at the UWI. Our first presenter, a pharmacist with over 25 years of experience, that's Dr. Lisa Bromfield. Her area of expertise includes clinical skills in infectious diseases. She has certification in pharmacy-based immunization delivery by the American Pharmacists Association, and in March 2008 was certified as an immunization faculty trainer. She is also a trained certified pharmacist in HIV voluntary counseling and rapid testing and CPR. She is a lecturer and program director at Utech, Jamaica, and also at the UWI. Ladies and gentlemen, let's now welcome our first presenter, Dr. Lisa Bromfield.
Thank you very much, and good afternoon, everyone. It's a pleasure for me to be here in the PSJ Forum. And this evening, I am tasked with answering the question, are the COVID-19 vaccines safe and effective? But before we talk about this, we want to just briefly review how the different vaccines work. So I want to share with you something that's interesting. Did you know that the coronavirus got its name because of the spiky proteins that are found on the surface of this virus? This spike protein is important because it is the focus of most COVID-19 vaccines, as it is the part of the virus that actually attaches and enables the virus to enter into our cells. So let's talk some more about the vaccines itself. We have viral vector vaccines like the AstraZeneca and the Johnson & Johnson, and we have the mRNA vaccines such as Pfizer. How do these vaccines work? Well, what's important to know is that the viral vector and the mRNA vaccines, they use a short piece of genetic code, and they take this genetic code from the COVID-19 virus and they inject it. When that happens, it uses your cells to mimic the way that the virus usually reproduces during natural infection. And what the body is actually doing is, rather than creating copies of the virus itself, it's creating copies of the spike protein. And this spike protein is what is going to be displayed on the outside of our cells. And our immune system now will say, but this protein don't look right. This protein is not like my other proteins. It doesn't belong. And so it triggers the immune system to produce proteins that we called antibodies. And by activating not just the antibodies, but other different cells in our bodies, it fights off what it thinks is an infection. So at the end of this process, what's happening in our bodies? We have learned how to protect ourselves against future infection with the virus that causes COVID-19. So here we see the Pfizer vaccine, the mRNA vaccine. But this mRNA is very, very fragile, and it would be destroyed by the enzymes in our body. So what they've done is to take an oily bubble of liquid, wrap it around the mRNA vaccine, and what you can see here is that as it enters into our cells, it will make specifically the spike protein, which are placed on the surface of our cell. And then what about the Johnson & Johnson and AstraZeneca? Does it work the same way? Well, it's a little bit different. So they're called viral vector vaccines. So what they do, they use a vector, which is a different harmless virus, and you want to deliver some important instructions to our cells. In this way, we're delivering DNA. So basically, the viral vector just acts as a shuttle. So it just takes the genetic material to the cells so it can cause your immune system to respond. So here we can see the viral vector protecting the genetic material that comes into our cells. The DNA is then changed over to this fancy RNA, and it makes the spike protein, and then the spike protein is then displayed on the surface of our cell, and our body will respond. So based on what we know now about how the vaccines work, do we believe that they're effective? And I will say to you, yes. There are clinical trials that have included at least over 20,000 participants in what we call randomized placebo-controlled trials. This is the highest level of evidence that we have. And through that evidence, it has shown that it reduces the risk of COVID-19, severe complications, and is effective against hospitalizations. But no vaccine is 100% effective, and there are some who may still get sick. But what is important is that the vaccine provides the best protection against serious illness and death. So if you do have it, you have less severe symptoms, you have less likely to be in hospital, less likely to die than those who are vaccinated. And then the question is also asked, but the virus keep changing, it causing the forming of variants. So I'm here to tell you that COVID-19 vaccines are highly effective against preventing severe disease and death, including the Delta variant, which is the one that is being very topical at this time. And what do you mean by a variant? The variant is just really a mutation, a change that occurs in this fancy spike protein that we've been talking about. And what happens is that every time the virus circulates and causes an infection, it will cause errors as it multiplies. And so this is how we get these mutations, or what we call variants. So the more opportunity the virus has to spread, the more it replicates, and the more opportunities it has to undergo these changes. And so that is why we need to be vaccinated to interrupt the spread of the COVID-19 virus. And then we talk about safety. People are concerned about whether or not these vaccines are safe. So I want to reassure you that there are strict protections in place to help to ensure the safety of all of these COVID-19 vaccines. They have to undergo rigorous testing in clinical trials before they can be approved by the World Health Organization or other national regulatory agencies, and they have to meet certain benchmarks for safety and efficacy. And the World Health Organization and other regulatory authorities, including in Jamaica, our own pharmacovigilance system, which is found within the standards and regulation at the Ministry of Health and Wellness, they monitor. So we monitor the use of the vaccine so that if we identify and respond to any safety issues, we can respond quickly. But many people are still wondering whether or not the way we develop these vaccines so quickly, did we in fact sacrifice safety? The answer is no. And there are a few things that you need to note. One, the researchers were able to move quickly because of what they already knew about related coronaviruses, because of what they knew about mRNA technology. And also, what was good is that around the world, the regulatory authorities like the FDA, the CDC, the European Medicines Agency, the UK Regulatory Authority, and the World Health Organization, they were able to collaborate. And so as vaccine research and development took place, these regulatory bodies prioritized the review of the information and was able to give the necessary recommendation. In closing, I would like to say, vaccines are safe and effective. They help you from getting seriously ill. And when you vaccinate yourself, you actually also protect the people around you, those that may have more severe illnesses from COVID-19. Thank you.
Thank you very much, Dr. Bromfield, and thank you. Our second presenter will be Dr. Winsome Christie. Now, Dr. Christie is the president of the Pharmaceutical Society of Jamaica, a clinical pharmacist and a registered pharmacist for over 30 years. She is also a certified immunizing pharmacist with the American Pharmacists Association, a certified pharmacist in CPR, HIV medicine, and is an approved provider of antigen testing for COVID-19 with JANAC, a lecturer at the University of Technology, Jamaica, and an integrative health and medicine specialist. Ladies and gentlemen, Dr. Winsome Christie.
Good afternoon, everyone. I'm going to be speaking to you about the side effects of vaccines. Now, all vaccines have common side effects. Once you get the vaccine, you end up getting fever, fatigue, headache, muscle pain, chills. So basically, you're getting symptoms of the flu. You may also have diarrhea. Pain at the injection site is due to the fact that the fluid is injected into your arm or wherever they inject it. And so the fluid there will cause a discomfort. And this discomfort might increase as the days go on. You know, when Jamaican, when you get cut, then say it gets stale and then it hurts more. But it's not that it's going to be very demobilizing, so you can't move your hand or anything, but you just feel the sensation. You may have itching and you may have fainting, but the fainting is not due to the vaccine. The fainting is because the body reacts to trauma. When you're frightened, you stimulate the nervous system that results in a drop in blood pressure. Your heart rate slows, the blood vessels open, and so the pressure drops. If it drops enough, the blood leaves the brain, and then you faint. So that's why men, when they go to the delivery room, they'll faint because of all the blood and the trauma happening to their wife, right? So that's just a normal reaction because of fear. But a tip, when you're going to take your vaccines, an hour before, you can take 2 paracetamol tablets. Then 2 hours after, you can take another 2 or 1 tablet. Then you take this 2-3 times daily for at least 3 to 4 days. This will reduce these side effects. For the itching, you can take chlorpheniramine or diphenhydramine to help with itching at the site. There are more serious side effects, though, which require urgent medical attention. These include difficulty breathing, chest pain, confusion, loss of speech, or mobility. When you have these things, you have to call your healthcare provider. There are some other side effects that people speak about. Myocarditis, which is inflammation of the heart muscle, or pericarditis, inflammation of the membrane surrounding the heart. Now, these reactions are very, very rare. Let me tell you how rare. These happen after the second dose of the mRNA vaccines like Moderna and AstraZeneca, yes? Now, for every 1 million second doses, for men between the age of 12 to 29, you have 40 cases of persons having this inflammation. For every 1 million doses among women the same age, you have 4 cases of women having these illness. So it's very, very rare, very, very rare. Blood clots also can be accompanied when you get the vaccines, especially for the AstraZeneca and Janssen vaccines. But again, these are very, very rare occurrences, and they happen within 3 to 30 days after getting the vaccine. Now, these 2 points, for the reduction of fertility in women and men, these are really speculations. How it comes about, they're saying that the spike protein of the coronavirus resembles a protein in the placenta of a pregnant woman. And so people are theorizing that the vaccine may attack the placenta and so interrupt the pregnancy. Now that's implying that the immune system is going to get mixed up. Our immune system is far superior to what's going on here, so it's not going to get mixed up. And also there's no medical or scientific mechanism to explain how the vaccines would interfere with a fertilized cell or prevent the fertilization of a cell. Another thing they speak about, and I've heard it, men are now saying they don't want their boys to be vaccinated because they're not going to be able to get a woman pregnant. And how did that come about? Because they have found that when you get the COVID-19 infection, it impacts your sperm production, and they find the virus in the sperm of men. Also, men who have had the disease, not the vaccine, they complain of scrotal pain or testicular pain after they get the COVID-19 vaccine. So you know what? If I was a man, I would take the vaccine because I don't want anything happening to my sperm or my scrotum. Now, enlarged lymph nodes. This is actually a normal reaction for those who it happens to. It didn't happen to me when I got my injection, but it may happen to some persons. It happens 3 to 4 days after the vaccination, and it's normally on the same side, the same armpit of the side you got the injection on. But the good news is it returns to normal about 4 weeks later. Now, during the chikungunya outbreak, you did see people with enlarged nodes at their ears and all around because the body was reacting to the chikungunya infection. So it's a normal reaction. But of course, we get concerned because lymph nodes are associated, enlarged lymph nodes are associated with cancer. So what you would do if you do get enlarged lymph nodes and they don't resolve quickly enough, then you follow up with your doctor who will perform ultrasounds and ensure that everything is going quite normally. Now, there have been deaths due to the COVID vaccines, but as of now, August 9th, 2021, after giving 351 million doses of the COVID-19 vaccines, there have been 6,631 deaths. That's 0.2% of the persons who get the vaccines will die. So it's very, very rare. And sometimes the death is not really correlating to the vaccine. What happens is you have a vaccine adverse events reporting system. And anything that happens to a person once they've gotten the vaccine has to be reported. So even if the death is unrelated, you have to report it. So sometimes you might be getting reports that's not really related to the vaccine, but nevertheless has to be reported. Now, studies have shown now too that there are benefits of using supplements to reduce the risk of infection due to COVID-19. And so you can also use the supplements after you've taken your vaccines to help reduce the inflammation, to reduce the potential for clots to develop. In a large observational study in the UK, there were 370,000 who were interviewed, and they found that those who took vitamin D3 had a reduced risk of infection by 9%. The probiotics helped to reducing the risk by 14%, and omega-3 helped to reduce the risk by 12%. Also, the loss of taste and smell was also reduced by 5% as a result of taking these supplements. So can you imagine what happens when you get the vaccines and you're taking these supplements? You're protecting yourself against reinfection and other illnesses. Also, research shows that herbal teas such as ginger, which we have, fever grass and turmeric, are excellent in mitigation with COVID-19 illnesses, side effects we may get from the vaccines. I just wanted to mention, a lot of the drugs we take have side effects, but it's like in 1% of the population that might have it, meaning it's not very popular. Aspirin, one of our wonder drugs, causes bleeding and stomach ulcers, but it's excellent to prevent heart attacks. It's the go-to drug to prevent cardiovascular events such as strokes. Paracetamol can damage your liver, but we need it, especially when we have pain or fever. I take it. I took it when I got my injection. So we just work with the doses to minimize these effects. And that's what they do with the vaccines. Everything is dose related and controlled. With that, I thank you very much for listening, and I turn back to the moderator.
Thank you very much, Dr. Winsome. Christie. Now, our third presenter is Dr. Ernestine Watson. She is a former president of the Pharmaceutical Society of Jamaica, owner and operator of Everybody's Pharmacy, clinical pharmacist, pharmacy preceptor for students with Utech Jamaica and Pharmacy Council, certified immunizing pharmacist with the American Pharmacists Association, and certified provider of CPR, lecturer at Utech Jamaica. Dr. Ernestine Watson.
Good afternoon. This afternoon, thank you, moderator. I will be speaking on the vaccine and persons who have comorbidities. The question has been going around. If I have the vaccine, if I have a comorbidity, can I take the vaccine? And so what we are attempting to answer this evening is that if I take the vaccine, will I respond effectively, or will it make me worse? What about pregnant women and breastfeeding women? So let's look at, if I take the vaccine, will I mount a response? In other words, if I take the vaccine, will it help me, right? When I have an underlying condition. So what we have mentioned about the studies that were taking place. And so from information coming from these studies are showing that the guidelines that have come up as a result from the USA, the UK, the EMA, WHO, they are all recommending that patients with underlying conditions should actually take the vaccine. As a matter of fact, the Advisory Committee on Immunization and Practices says that patients with underlying conditions must weigh their risk of getting the coronavirus, because as was mentioned before, persons with underlying conditions who get the coronavirus, they are the patients who may become hospitalized or end up having to get a ventilator. And we all know what is happening this weekend with the oxygen. The need for oxygen was so bad that the hospitals were starting to run out, right? Now, the most common diseases, underlying conditions that were mentioned, obesity. If you have a BMI of greater than 30, then you're at higher risk. People with diabetes, people with asthma, these are all patients who may suffer, right? So we look now at, if I take the vaccine, I have asthma or I have diabetes. If I take that vaccine, yes, it may work, right? I may mount a response, but what about my condition? What about my diabetes? Is it going to make my diabetes worse? And so again, we look at persons who may be doing cancer chemotherapy or on special therapy that is causing them to take drugs that are suppressing their immune system. Will they have a response, and will they react worse to the vaccine? Again, when we weigh the risk, all of the guidelines and throughout the clinical studies, it is being recommended And it was noted that these patients, their conditions did not get worse. As a matter of fact, when we look at the conditions that were listed, and the studies, persons, all of these persons with these different types of conditions were actually in the studies. Cancer, people with kidney disease, people with diabetes, both types, type 1 and type 2, people with heart conditions, people who were immunocompromised, right? They were all included. People with liver disease. We mentioned about obesity, people who were pregnant, people who had a long time history of smoking. They all benefited from taking the vaccine. In other words, if you are considering what is going to happen to me if I don't take that vaccine, and you consider that you may have the condition much worse than the person who doesn't have an underlying condition, more than likely you are going to be that person who will be getting a severe, or who may have to be ventilated, who have to be on oxygen. And guess what? Right around the world now, we have been looking at a lot of studies, right? Right here in Jamaica, the University Hospital of the West Indies, they pointed out that of their patients who are hospitalized, 96% of them did not have vaccine, were not vaccinated. But it's not just in Jamaica. Throughout the world, we hear of patients who are hospitalized, and the majority of them are unvaccinated. So we say in Jamaica, our situation may be that we didn't have sufficient vaccines, right? But we look at a place like Iceland. Now, Iceland, they have a majority of persons who are vaccinated. And before they got there, before they got to this current state of vaccinations, they were having serious hospitalizations. Since their level of vaccination raised to over 75%, their hospitals have no one, absolutely no one, who is vaccinated in either the intensive care or needing oxygen. So we do see that to avoid the risk of getting a severe disease, we have to be vaccinated. Now, if you are concerned, if you're at a point in time in your this condition. So for example, if you're a cancer patient and you are taking chemotherapy, you may ask, should I get that vaccine? Speak with your doctor. It can be arranged so that in between the time when you are between one dose, in between cycles, right, they check you and they can tell you if you are able to take the vaccine at that point in time. Because again, a cancer patient who gets COVID, they are more likely to end up with a severe case of the disease. Now we go to the very topical, the pregnant woman. Now I heard that some persons were saying that they will not take the vaccine because they want to get pregnant, or they may be pregnant, right? All of the studies are showing that pregnant women who become infected with the coronavirus, they are at greater risk. So the guidelines are recommended. WHO recommends the vaccines because the studies have shown that these pregnant women, they produce antibodies which have been found to actually protect the newborn. Same with the breastfeeding mother. The breastfeeding mother provides protection for that infant who cannot take the vaccine at this point in time. So what would a pregnant woman do? Weigh your risk. The pregnant woman would be at higher risk for severe COVID than the woman who is not pregnant and of reproductive age. The pregnant woman faces a higher risk of admission to intensive care unit. And guess what? if they get COVID, they are more likely to go on the ventilator. Another major issue is that a pregnant woman, the COVID virus, getting the COVID virus produces a greater risk for that baby. They're at a higher risk of the baby developing complications afterwards or having an unfortunate abortion. Now, this is a real story. This lady that I know, she was hospitalized at 7 months with COVID-19. And it is the doctor cried because the mother was doing so well. And she came in with the COVID-19, they tried everything, but she lost the baby. So it's something that you have to weigh those risks. Now, when should you get the vaccine as a pregnant person? Discuss with your medical doctor, your obstetrician gynecologist. They will guide you through, they will answer the questions. You can speak to us as pharmacists. We are easy to approach and we are available. So you may ask your pharmacist, ask your doctor, ask questions. Once you have satisfied yourself that it is the right thing to do, then you take the vaccine immediately. Don't wait. We have this situation now where at the beginning, persons were so hesitant to take the vaccine. And now what is happening is that it is so difficult. The lines are long and you have to be going from one side to the other. We don't want the pregnant woman, after you have made that decision to take that vaccine, go do it right away. We ask of you. So, in conclusion, I am convinced that taking the vaccine is the better way to go for the person with any of those conditions that I have spoken about, whether it is cancer, diabetes, whether it is liver disease, whatever the condition, you are better off if you take the vaccine, protect yourself from getting a severe case, protect yourself from being hospitalized, protect yourself from needing oxygen, protect yourself from lying on the floor at some hospital waiting. And then remember too, your condition may also go out of control. So a person with diabetes who is normally controlled and just able to take the medication, they may reach a stage where they now have to be taking several doses. So I would commend anyone to take it, whether you have a predisposing condition, if you are pregnant, if you are benefiting. Why? Because the benefits outweigh the risk of the individual getting that vaccine. I thank you.
Thank you very much, Dr. Ernestine Watson. Now, our final presenter, and I must tell those who are participating, thank you very much for joining us this afternoon. When we have the final presenter, then we are going to ask you, you can type in your questions, you can also raise your hand, and we will allow you to speak. But first, I suggest some persons wait until the final person has finished, then you can type in your questions in the Zoom chat. Thank you, Dr. Ernestine Watson. Our final presenter is Dr. Diane Newman-McKenzie. Dr. Diane Fiona Newman-McKenzie is a pharmacist for the past 30 years. One thing about these pharmacists, they have been around practicing their craft for a very long time. During her professional career, she has worked as a retail pharmacist, a distribution pharmacist, medical representative, district sales manager, business development manager, and as a training manager. Currently a lecturer at UWI and is a certified immunizing pharmacist with the American Pharmacist Association. Our final presenter, Dr. Diane Newman-McKenzie.
Good afternoon, everyone. So my task today is to answer the question, is the Pfizer vaccine safe for our children? Well, I'm sure you'll all agree with me that we are truly in a universal crisis. And according to UNICEF, children are at risk of being among the biggest victims. Sometimes the impact for our children will be lifelong. So in terms of looking at UNICEF and their reports, they're saying that of the total cases of COVID-19 infections, children represents 14%. And this data was taken from 103 countries around the world. I want to take a little moment to bring it home a little bit closer to everyone, because in the US, in the week of August 5 to 9, they saw a 7% increase in the infections in children. And in the week of August 12 to 19, the infection rates among children represented 22.4% of the infections. What this also led to was an increase in the hospital rates in terms of hospitalizations of children. Let's take it a little bit further, home to Jamaica. For Jamaica, in our children 0 to 9 years, and this is dated today from the Ministry of Health, we have 3,573 cases from ages 0 to 9 in Jamaica who are infected, who have been shown infection with COVID-19, and ages 10 to 19, it shows 5,193 cases. If we look at the total in terms of our figures, we're looking at almost 9,000 cases of infection with our children. This represents about 13% based on today's total figures of 67,402 cases. This is similar to what is happening in Australia, because in Australia, for example, the data shows that they have about 13.4% of the cases showing up in about ages 10 to 19 years. And however, though, with the surge of the Delta variant, they have been showing that the cases within children are rising to about 18%. Jamaica is yet to see the effects of the Delta variant of COVID-19. The second point on my slide speaks to the negative impact on children. Of course, we look at education and the impact this has had on education. And in terms of looking at the effects, UNESCO reports that at least 1 in 3 of the world's school children are affected because of remote learning. They can't get on remotely. And what this is showing for us is Jamaica is no different. We have had situations where our children have no access to the technical devices. We have electricity outages. We have learning gaps, whether it's related to the children or to the teachers in terms of meeting their needs. And of course, nutrition. Some schools have meal programs for children, but they're not going to school. So the balanced meals are not as you would normally have it when they were going to face-to-face school. Other impacts would be based on vaccination and on the coverage for vaccination against other diseases as well. The CDC reports, for example, over a 4-month period from February to July 2020, that's my third bullet point, that they had 121 deaths related to COVID infections in persons younger than 21 years. Of that age group, 85% of those deaths were related to persons who were in the age range of 10 to 20. So what's the current status of the Pfizer vaccine? Well, we know last Monday that the FDA granted full approval for the Pfizer vaccine for ages 16 and over. And the Pfizer vaccine has the emergency use authorization for ages 12 to 15 years. We don't have a vaccine to date that we can recommend for ages below 12 years of age. However, there are studies ongoing and they're taking it in stages. So hopefully by the end of fall, we will have the next level of vaccines available for, let's say, ages 5 to 11 years. And then they're taking it in phases when they'll be looking at studies that will target children between ages 2 to 5, and then even from 6 months up. The good news on the last bullet on this slide is Jamaica has started vaccinating its children ages 12 to 18 years, like many other countries. So what's the question? Is the Pfizer vaccine safe for our children? Well, the studies that have been done have looked at over 2,200 children. And when they looked at it, more than half got the Pfizer vaccine, and the remainder of the children, they got what we call a fake or placebo drug. And when they looked at the data after 2 doses, 1 week after, it showed that the Pfizer vaccine was 100% effective when they looked at the age group of 12 to 15 years. In the ages over 16 years, it showed 91% effectiveness in preventing severe illness. And against the Delta variant, the Pfizer vaccine shows 96% effectiveness in preventing severe disease. So it's interesting to note that in Florida, they have a vaccine campaign for their children. And you can see this girl with her mask on. It is saying, I have more confidence in the vaccine than I do the COVID virus, because the studies show the common side effects that can be present after a vaccine shot or after vaccination. So you get pain at the injection site, fatigue, headache, chills, muscle pain, fever, and joint pain. And this was shown based on the side effects that occurred in ages 12 to 15. Other rare side effects that was shown was myocarditis, that's inflammation of the heart, pericarditis, inflammation in the lining outside of the heart. Note though that these were rare. It took millions of doses before these side effects were showing up. And after treatment, after the patients received professional care, they resolved very quickly after medication and resting. The question may be asked, can the Pfizer vaccine affect my menstruation? And a small number of females have come forward reporting cases. As a matter of fact, as of May 2021, there are about 4,000 reported cases. But it is not clear whether or not the COVID-19 vaccine is directly related with it. So it's being monitored now, and they are taken into consideration, the reports. But it is important to note that menstrual cycles can change based on, let's say, having an infection, under stressful situations, sleep problems, changes in diet and exercise. So the question may be asked, who should not be vaccinated with the Pfizer vaccine? If you're under 12 currently, we're not recommending vaccinations. Clinical trials, as I mentioned before, are being done that will involve a younger age group. We will know the results soon. And of course, if you have had any severe allergic reaction, or if you're allergic to any of the ingredients in the vaccines, you should not take the Pfizer vaccine. The question may also be asked, can the Pfizer vaccine give me COVID-19 infection? This is a resounding no. The Pfizer vaccine does not contain the virus, so you cannot get an infection from this. So what dose is recommended for the Pfizer vaccine? The doses are the same as adults. If I get a dose today, within 3 weeks or within 21 days, you complete the series with your second dose and you'll be fully vaccinated. So why should our children be vaccinated? One, we want to prevent the spread of the COVID-19 infections. We need to prevent suffering with our children. We need to prevent hospitalizations and death. And we need to get back our children's lives to normal. Let's all get vaccinated and stay safe. Look at the vaccine, look at the protocols that are in place. Getting vaccinated is our best solution right now. Make that appointment. These are my references. And in closing, every vaccination counts. Thank you for listening.
Thank you very much, Dr. Diane Newman-McKenzie. And that is our final presenter for the afternoon. Of course, we had a panel of very distinguished guests. We have Dr. Winsome Christie, president of the Pharmaceutical Society of Jamaica, clinical pharmacist and lecturer at Utech, Jamaica. We have Dr. Ernestine Watson, immediate past president of the PSJ, Dr. Lisa Bromfield, and also Dr. Diane Newman-McKenzie. At this time, we'll be taking questions from our guests. You can raise your hand in the chat and someone will see that hand. Just go to chat and you click on raising your hand and you can ask your questions. Also, I've been looking at some of the questions that you have posed here. Don't let them come too fast and furious so that I can read them one at a time. So I have one here. This says, does Pfizer have a side effect called oh, somebody had to show that one on me and the pharmacist will help me. I think it's pronounced Guillain-Barré syndrome.
Right. Let me see if I can take this one and my colleagues can back me up.
That's Dr.
Newman-McKenzie, right. The Guillain-Barré syndrome has been reported with some of the vaccines. In terms of my reading, I'm not seeing on my radar
Yes.
the Guillain-Barré syndrome being coming up for Pfizer. My colleagues, you can confirm in terms of looking at the side effects.
Right. I think we have a hand up now, and I'm going to ask my producer to allow that person to speak. Is that person all ready to speak? I wonder if that authorization has been given to that person to speak. And if you are on, yes, I think I see a hand there. But I tell you what, yes. Is that Maurice? We're not hearing Maurice at all.
Are you hearing me?
Yes, go ahead.
Okay, I have a question for Mrs. Newman-McKenzie. She gave the presentation about the vaccine on children. She also gave some data which spoke to the fact that 121 children had died. Now, based on the data presented by the chief medical officer here, it showed, which we already know, that children are the least affected. In fact, I remember the last set of data she showed, from February till now, we haven't had one death in a child. And based on what she showed, it has 121 deaths coming from UNICEF. Now, looking at the death across the world of 4,121,000, whilst we're not trying to play with the importance of life, but that is minuscule in the ratio of 4.5 million. In fact, 6,000 and something person died from side effects from the vaccine is the confirmed number that she's saying. So if we're not experiencing death in children, and if it is that the empirical evidence is showing that children are not severely affected and hospitalized, why are we mandating the vaccination of our children? Because nothing shows that even if there's an increase in infection, nothing is showing that.
Right, let them proceed to answer, sir. Let them proceed to answer that question.
All right, so I just want to be clear on the question, sir, because I'm hearing several things coming out. So just redirect me to what you would like me to answer directly, and I will do so. Is it what you're asking, the importance of vaccination for children? I want to see if I can answer correctly, but I need to understand what you're asking at first.
We're asking him to unmute. I don't think he has.
Yes.
Okay.
Are you going to proceed? Just proceed for me, sir. Just clarify that point.
So what I'm asking, if primarily coming from what you're saying, the importance of children being vaccinated is to contain the spread and allow them to go back to school for the purpose of education. Now, the vaccine does not prevent the spread. It does not prevent you catching it or transmitting it, according to science, according to Fauci. So it doesn't help in that regard. The children are not severely affected and are not dying from the virus. So I'm still trying to understand the importance of mandating children to be vaccinated.
Okay, all right, great. I think I understand your question. So in terms of looking at vaccination and vaccination spread, let me just give just a quick example. I hope if I can explain it quickly. If one person gets infected, that one person can replicate the virus. Almost 1 billion virus one person can replicate. In replication of that virus, every time that virus, we allow that virus to replicate, we are allowing that virus to replicate. It doesn't replicate properly sometimes, and it causes a mutation. So what we need to do in terms of looking at children, at looking at adults, we need to reduce the spread by preventing the replication of the virus. And the best tool that we have right now is through vaccination. By vaccinating, we are reducing that spread. We are reducing a variant. We are reducing also, for example, what we're noticed with some of the variants, because remember we had alpha, beta, gamma, now we have delta, and here we have lambda. What we're having with among the virus with the various mutations is more contagious, being the infection being more contagious, being more resistant, causing more deaths, causing more hospitalization. I show the trend that was occurring within the US, that the increase just in August alone due to the Delta variant, it is increasing the infectivity. And of course, children becomes a source to their loved ones at home, to the elderly, to the other persons who are vulnerable. So we want to ensure that we vaccinate every single one, and everybody should be deemed important. One life lost is one life too many.
May I also add, I want to stress the point that Dr. Newman made about the older persons and persons who the child can infect. The fact is that the vaccine does reduce the volume of the virus that the person can produce. And so for children who are not vaccinated, we don't have that effect. But in addition, children are loving, they touch, they communicate, they don't know, they can't maintain protocols, right? Even the teenagers, as they get together, they hug, they talk, they take off the mask. So what is happening is that these become carriers to the homes, and especially in our Jamaican situation. And the entire Caribbean, as a matter of fact, we have generational home family living conditions. So they go home and they infect auntie who is diabetic and grandma who has diabetes and hypertension and probably kidney failure, on the verge of kidney failure. So this is what we want to reduce. And then again, we go back to that situation of the hospitalizations. When these children go home, they infect the older ones crowd our facilities. And unfortunately, we don't have the means to maintain it.
Okay, thank you very much, Doc. Let's go now to a question from Peter Gay Bailey.
Hi, everybody. So I hope I don't ask a question that's been answered already.
Let's go ahead and ask your question.
Okay, cool. So I have a concern from the perspective of I really don't want to take the vaccine because I feel like my white blood cells and my body is supposed to naturally fight and have a defense mechanism against external viruses. So my concern is if I choose not to take the vaccine, right? Ultimately, who will I really be impacting? Because it sounds as though even though I catch the virus, even though I catch COVID, I will still be able to carry around a variant to other persons and my risk will be reduced. However, if I don't take the vaccine, won't it still kind of be the same chances? Won't it be the same risk on both sides?
All right, I'll take that one, if that's okay. The COVID-19 virus, you are taking a chance by not being vaccinated, which means that you have the potential to develop severe infections, end up in a hospital on a ventilator, or even die. And that's the purpose of the vaccines, to prevent serious illness, hospitalizations, and death. So your chances of getting a severe infection are much greater when you don't take the vaccine. The other challenge is that you are a source of infection. I can share with you my personal experience of some family members of mine who do not want to take the vaccine. And right now, that infection has spread to 2 individuals, one whom ended up in hospital. So, Peter Gay, you can take your chances and say that that's a personal choice. But the question is, where does your personal choice, if it affects the lives of others, then that becomes a challenge. And you don't know how that individual is going to respond to the COVID-19 virus. So the best chance that we have right now, we take the vaccine to protect against severe illness, against hospitalizations, against death. But guess what? We also use the other protocols. So we put on the full armor like you're going to war, right? So you put on a vaccine, you put on your mask, you do social distancing, and you wash your hands and you sanitize. I hope that answers your question.
Thank you very much, Dr. Lisa Bromfield. Let's go now to Bravo. Still here, waiting to hear from Bravo. If we don't hear from Bravo, we might have to move on. Bravo?
Yes.
Right. I'm going to ask all the participants, if you are listening, you must listen carefully. So the moment, and you must observe, the moment you are asked to unmute, you must unmute immediately. Thank you. Go ahead, Bravo.
Question. My question is, I'm having a swell, my body is swelling. Doctors are yet to find out what is causing it. How do I know that if taking the vaccine wouldn't cause more complication?
All right, it's Bravo, it's a difficult question to answer because we are not aware of what your medical history is. And so my recommendation would be that you engage your physician who may have a better understanding of what's causing the swelling, because the swelling could be for many different reasons and we don't know.
That's the point. They can't find out what is causing it as yet.
So then it has to be the advice of your physician to say, yes, you can take the vaccine, or no, you can't. And what is important to note is that, remember that when you get the vaccine, they observe you for about 15 to 20 minutes afterwards to see if you're likely to have any allergic reaction to the vaccine. Hope that answers your question.
All right, thank you very much, Lisa Bromfield. Let's go to this. Let's go to Cassie, iPod. Still waiting on Cassie, iPod.
Good afternoon. Are you hearing me?
Good afternoon. Go ahead.
Okay, I have 2 questions. Because I know the time varies for some country depending on the country that you're in. How long should you wait after getting the COVID virus? How long should you wait after to get your vaccine? My next question is, I know Jamaica is really on the part for using AstraZeneca as our, I'm probably not going to say main source of vaccination, but based on studies, it shows that AstraZeneca should only be used for older folks. So is it a case that we can push, or what are the studies comparing AstraZeneca to Pfizer, which would be better vaccine for those age group?
Okay, I'll take the first, and I think Dr. Bromfield, she's smiling, so I think she'll take the second part. Okay, for the first part, the initial stages, it was recommended to wait 3 months. But what doctors have been saying of late is you should definitely not take the vaccine when you are having symptoms. So you should at least wait until you are better. And some doctors will also advise maybe 3 weeks or so after. The point is not to take the vaccine while you are having symptoms. And again, like Dr. Bromfield had recommended, this could be a discussion that you have with your physician. Depending on your medical status, the doctor may say, wait a little longer and give you a good timeline to get the vaccine. Dr. Bromfield, over to you for part 2.
Yes, I agree with Dr. Newman-McKenzie. The CDC, Center for Disease Control, recommends about 90 days, but it says fully recovered. So how we define fully recovered in you may be different from the timeline for fully recovered may vary from person to person. So I would say, yes, consult with your physician and they will help you to make a choice for when you are ready. As it relates to the results of the AstraZeneca vaccine, the AstraZeneca vaccine has been proven to be effective in our elderly population as well. The Pfizer is effective in the elderly population, the J&J is effective in the elderly population. But the Pfizer vaccine received approval in May 2021 to extend the ages below 18. So all the other 3 vaccines that we have in Jamaica are recommended for 18 and above. But for the Pfizer, they have the evidence, as Dr. Newman-McKenzie presented, to support its effectiveness in 12 and above. And so that's why we're positioning the vaccine to be used in our children.
Thank you, Dr. Bromfield. Okay, let's hear from Mark. Cheryl.
Yes, 2 questions. With regards to the AstraZeneca, I heard that once you take that, you get the 2 doses, that it will cover the COVID-19, the Delta variant, and any other variant. However, I heard that the Pfizer and the Johnson & Johnson, when you take those, it will cover the COVID-19, but not necessarily the variants. Is that true, or that's just a rumor?
Okay, all right, I'll take this one. In terms of the variants, there are more studies that are needed to assess the complete effectiveness of the current vaccines against the variants. But basically, the reason that the vaccines will still retain protection is because when we generate an immune response to that spike protein that I was talking about, you get a broad sort of an immune response. So what can happen is that you will find that from vaccine to vaccine, they may not be as effective against the variants as it is against the original COVID-19 virus, right? Yeah. But what the recommendations coming out of the CDC and the World Health Organization, again, it's pointing back to the fact that it is the best strategy that we have right now. And so that's why, Mark, it's an excellent question that you asked. We have to get the vaccine, but also maintain the protocols because we are still learning. We're still learning about the virus. We're still learning about whether or not how long the vaccine will give us long-term immunity. We're still learning, but the challenge is we're in a pandemic. And so we have to interrupt the spread to prevent more variants. We already have so many. Do you want more to deal with? I don't think so.
No, I forgot to mention, Doc. I was told that they could take a booster with the Pfizer or the Johnson & Johnson to make up for that shortfall in the variant.
Well, that is actually being researched now, Mark. It is asking, you know, will I need a booster shot? But the challenge is that it's too early to know. And I don't know, when you and I were younger, you know, we got 1 MMR vaccine, right? Yeah. But then when our children came along, they got 2 MMR vaccines because with time we knew how long the immunity lasted and whether or not we needed booster shots. So they're following persons and time will tell.
Okay.
So that answers.
Other question.
In addition, Mark, I just wanted to share some data with you. I did show you that the Pfizer has about 96% efficacy against the Delta variant. AstraZeneca in the UK is showing about 93%. In Canada, there are studies that show about 88%. And the J&J is showing effectivity been effective about 8 months against preventing hospitalizations with the Delta variant. So they will vary, but the point is they will have their different levels, but the point is they are preventing hospitalizations and they are still helping to prevent death, which is better than nothing at all.
They're all good. They're all good. So I'm happy with that. The other question, I hear some persons say that the second dose should be like 4 weeks, 6 weeks, 8 weeks, different time periods. Is it according to the particular vaccine, or is there a standard protocol for the time frame of the second one?
I will take that. Okay. Thank you, Dr. Watson. So basically what happens is that the research, we are all looking at the trials. We are looking at the evidence. That is what the evidence is saying to us. So initially, they would have said that you take the vaccine within 8 weeks of the first one. What the studies, as we go along and they observe post clinical, it is showing that the period of time that you take the vaccine, when they do the antibody study, right, they have found that the level of antibodies that are as a result of your first dose, it means that you can get the vaccine anytime up to 3 months and still have an effective response by the immune system. So it's basically, you would measure the antibodies produced, and that will give you a better idea of how long you would take before you take another vaccine, the second dose.
Right. So to add to what Dr. Watson was saying, Mark, it's basically the research, and it varies from vaccine to vaccine, what they saw in terms of the antibody trends, which will determine when that second dose would have been needed. So it's through their clinical trials, because notice that J&J only requires one. So it's the clinical results that determined.
All right. I think, should I go to Skyers? Skyers now? Skyers, good afternoon. All right, not hearing him. Let's go to Nicole Myrie. I'm going to ask you to unmute your mic and go ahead with your question.
Hi, good afternoon, everyone. I know persons who are currently, I've heard of about persons who are currently taking ivermectin as a prophylactic for the prevention or as a treatment for COVID-19. Any advice or, on the use of this drug? Also, question number 2, if you take a vaccine such as AstraZeneca, a lot of persons are asking, are you able to take another brand for the second dose? So if you take the first dose, AstraZeneca, or any of the vaccine, can you take another brand for the second dose?
I would like to answer that. The studies are showing, as we've been referring to many studies, they are doing research at the moment to show that if, for example, you took the AstraZeneca and there's no way you can get another dose of the AstraZeneca, for example, the country doesn't have any, but they do have the Pfizer, then you can get the second dose with the Pfizer or the Moderna if it's available. However, it's not really recommended. It is recommended to try and get the second dose with the one you started with. However, in dire circumstances, you can use another type. So for example, the AstraZeneca and the Pfizer were the two that were being reported on in the study. And the studies do show that using these two different types did provide a better immune response in the clinical trials when the both were combined. So there are trials showing that there is a benefit to combining two different types of these vaccines. However, there is a specific order of using them. So it's all based on clinical trials at the moment. But in all due, protocol dictate, you stick to the same vaccine. You cannot say give Janssen, though, the Johnson & Johnson vaccine with the others. That one is totally out. That one cannot be given as a second dose. It has to be the others that have 2 doses.
All right, thank you very much. Let me go to, is it Brenda? Brenda, you can go ahead and ask your question.
Good afternoon. Good afternoon, everyone.
Good afternoon.
I would like to know if there's any truth to the rumor that the AstraZeneca is the virus itself. And does it cause blood clots?
All right, so I'll take the first part of that question. It doesn't contain the virus at all. Basically, what we've done is to take out a piece of the virus that codes for what we call a spike protein. It's a protein that's found on the surface of the virus, and that protein attaches to human cells and causes the entry of the virus into the human cells. So what we do is that we just take a little code that codes for that protein, and then we will produce these antibodies against it, right? So if you're coming in contact with the infection again, your antibodies are ready to fight, okay? So it's not the actual virus that we use, and the genetic material is very specific. It's like your genes determine the color of your eyes, how tall you are, color of your skin, all those things, all of what make you you is what your genetic material. And so the codes are very specific. So no, it does not contain the virus.
Okay, for the second part of that question, with regards to looking at blood clots and the AstraZeneca vaccine, there have been reports. I must say that there are rare cases. They have found that persons under the age of 55 are more at risk. The data is coming out, I think, being very rare. It means that maybe 1 case in every 200,000 persons were vaccinated. The experts have looked at it, the regulatory authorities have looked at it, whether benefits outweigh risk. And of course, it is showing that vaccination is much better than having to succumb from the COVID-19 infection. And the observations, monitoring is continuing, but the decision to continue to vaccinate and of course, observing persons who would maybe be at risk for blood clots, or persons would be, and I'm thinking brochures would be given when at the time of vaccinations to alert persons to what symptoms to look out for, reporting to your doctor if anything is unusual. But the point is, yes, it does have the risk, but it's very rare.
All right. What if Dr. Christie want to come in
to
here?
support what Dr.
Yes.
McKenzie was saying. Sorry?
Yes, go ahead, Dr. Christie. Dr. Christie?
Thank you, Mr. Yes, sir. Thank you, Mr. Darby. Right. To answer your part about the clots, as Dr. Newman-McKenzie was mentioning, that side effect is more common with the AstraZeneca and Janssen or Johnson & Johnson vaccine. And as she mentioned, it occurs 3 to 30 days after vaccination, but is extremely rare in 0.2% of the population or less. So it's not, that's a very rare popular occurrence. In relation to ivermectin is registered in Jamaica to be used for parasitic infections. There are off-label uses that doctors can, at liberty with their license, prescribe the drug for. So if the doctor is using it for an off-label use, then they have to advise their patient, because pharmacists are to dispense based on how the Ministry of Health and Wellness gives us the protocols that would cover us. So we can help to monitor side effects, etc. But basically, we make sure the doses are within the limits that the manufacturers advise.
All right, it's about 40 minutes past 4. I think we can go right up until 4:30. We're going to be finishing earlier this afternoon. And of course, we can't answer all the questions this afternoon. The panelists will not be able to, but of course, the information will be posted on the Society's website, and I also will be posting the information, and you can continue to ask your questions. I'm still waiting. I've asked Mr. Cord Evans to unmute, and if he doesn't, I'm going to move to the next person.
Good afternoon, everybody.
Good afternoon.
Hi. Just looking at a couple of facts and based on the presentation. One, I learned that the vaccine does not stop or prevent infection. Two, the coronavirus belongs to the influenza family, right? So we can expect constant mutation. Three, we're looking at the mortality rate. I didn't hear anybody mention the mortality rate, which is less than 2% globally. So my question, especially based on fact number 2, that is the constantly mutating virus. Will we have to be vaccinated annually? That's my question.
Okay.
Can I take?
Go ahead, Dr. Watson.
Yeah,
Go ahead.
I would just like to address the part about the percentage mortality. And as persons who, in the Caribbean, so many of our patients as pharmacists, 80% of our patients are battling with chronic diseases. And so it puts them at a higher risk if they contract the virus, and therefore that in itself is going to push up the mortality rate. And the whole emphasis on us focusing not on the mortality rate of the person who contracts the coronavirus, but we have to focus on the long-term effect it has. We are talking about persons who may have been controlled for years, and all of a sudden their diabetes is off, they're having heart problems, the kidney is in failure, and some of the immunocompromised patients, they no longer can manage. So we have to look at the long term. We cannot just look at what is, okay, how many persons get the virus and how many people die immediately from the virus. That is bad. 2% is bad. But it is even worse, the long-term effect that we will have on all of these. Right now, persons with diabetes and hypertension and cardiac problems, they can't even access the hospital. So even while we are dealing with the fact that they are not dying, we are dealing with the fact that persons who have surgeries to do, persons who have cardiac or heart failure, they can't go to the hospital now and get an emergency surgery because we are out of oxygen. So we have to balance. We cannot just look at the fact that it's less than 2%, so why are we bothering? Why are we bothering? Because persons have long-term effects that cause a strain on the individual, the ability to work and function. They lose days at work, the productivity is reduced, the hospitalizations are increased, and the list goes on. And the quality of life, we want to live. We want to have a good life. We don't want to live in fear that I may be the one who die. So that's how I would answer that aspect of it.
I just wanted to add, Dr. Watson, I think the question came that the COVID-19 belongs to the influenza family, but it actually belongs to its specific family of coronaviruses. We are still learning about these mutations. And so the best strategy that we have is to continue to vaccinate because we don't want more variants to be produced.
Since you mentioned that point.
I also think the question
sorry.
was asked about whether or not we may need annual vaccinations. We are not sure.
No.
Right? We're not sure. And the point is we learn as we go, we're navigating and we're charting our course as we go. The point is we never knew we needed an influenza vaccine every year initially, but now we know we need an influenza vaccine and we do take the influenza vaccine. So if it happens, and that's the best way to navigate and move forward, we will maybe have to get an annual vaccine. We don't know.
Somebody mentioned about flu and the virus. I would love to hear the distinction as to, because we all refer to this virus as coronavirus, but my understanding it is a classification of viruses, and what we're talking about is COVID-19. Who can help me with that?
All right, so they're classified based on their shape, specific features that the viruses have, how they spread the infection. So all of that puts them in a particular category. The challenge we have with the influenza virus is that the mutations that take place, they can be drastic, meaning a very wide change, so that the vaccines that we had the year before would not protect against the strains that are circulating the following year. Influenza also has a peak season. So anywhere between October to about April is when you will find the influenza virus circulating. And so basically what we do is we do surveillance, we test persons, we get an idea of what types are circulating, what mutations may have formed, and then a vaccine is developed in a short space of time to be targeted against those particular strains that are circulating. So it mutates much more rapidly, as I mentioned, and when it mutates, it has deviated so far, we call it an antigenic drift. It drifts so far that the previous vaccines will not provide you enough protection. So we vaccinate annually. I hope that answers the question.
All right.
I'd like to add to that, please.
Yes.
Right, the coronavirus, it does result in similar respiratory tract infections. In fact, that's how it was first identified, and that affects the lungs. But because of how it's mutating and changing, and because of the different receptors, it acts really on the ACE receptors, which primarily are concentrated in the lungs. But these receptors are also distributed over the entire body. And so the coronavirus, because of how it interacts, it will give you symptoms like the flu, but in addition, the loss of taste, loss of smell, and the huge inflammatory response that results in thick mucus in the lungs, worse than asthma, that cannot move. It also results in cardiac effects, kidney effects, brain effects. And so it's much more detrimental and dangerous than the flu. And it's actually in a different class than the influenza virus because of its shape and its crown shape. That's why it's called corona.
Well, probably we have another 7 minutes, but I think the pharmacists, all of you, they would love to answer this question. And I'd love to know. I understand that quite a number of you have been trained to administer the vaccination. So I understand you're sitting down on your training and your skills when the whole of the nation, persons who are living in Lower where I come from, acting bed, wait a bit, you name it, they need a vaccine. Why can't you, the pharmacists, have been trained? Have you been just trained to sit down?
Well,
okay.
I think all of you want to answer.
We go one at a time.
We are going to encourage the public, all of you here, and tell 2 persons to agitate so that the minister and the Ministry of Health and Wellness would put what is in place so that we can go ahead and assist as we are trained and willing. We are also very effective because pharmacies are located all over the island. We are in rural areas. So we are ready, and we have been agitating from about 2016.
Yes.
Right? We have been agitating. So we now need the public to assist us with to make the voices louder.
You say that somebody is suffering what we call it in the country hard of hearing? Well.
I can only say, Vernon, we are in negotiations, we are in discussions, we are engaged with the Ministry of Health and Wellness as it relates to pharmacists immunizing, and we are praying for a good outcome.
You're praying and hoping. Let's hope you don't live in hope and die in despair, because poor Jamaicans all over, from St. Elizabeth to Trelawney to Manchester, Hanover, all of the country, they love to take that vaccine. And I get complaints on a daily basis that where they live up in the hilltop there, not even helicopter can go up there. So I think if we can get all of you who are qualified, gone are the days when I was a youngster and I didn't call you guys pharmacists. We used to call them what? Druggists, right? Now we call you pharmacists. We need to treat you as such, and we need the nation to also allow you to serve this nation as such. I think we can allow each of you, we will not be taking any more questions, but I will allow each of you to leave us with a parting shot. You can decide who you want to aim it at. Should we start? Who should we start with? Dr. Winsome, Christie, we should go with you last, ma'am. You're the president. Let's go with Dr. Diane Newman first. What's your parting shot?
My parting shot is protect each other, protect this Jamaica land we love, and take the responsibility, take the trust on yourself to protect yourselves, vaccinate, wear your mask, sanitize, social distance. Take that personal responsibility. Take it now and protect Jamaica land we love.
Thank you, Dr. Lisa Bromfield.
Wow, my leaving thought would be, let's get vaccinated and get back to life. I believe that we need to put on what I call the full armor. I believe that we are in war for this pandemic. And I agree with Dr. Newman-McKenzie. Let's get vaccinated, wear your mask, social distance, sanitize, and let's get back to life.
Thank you. Dr. Ernestine Watson.
Okay, so I heard an analogy that the vaccine is like the burglar bars on our houses. Now, most of us don't want to have burglar bars on, but we do it because there is a sort of delay. So if someone is breaking into our homes, we at least have the time to run, or probably to get protection, if we have a gun or a cutlass or whatever it is. So it delays and it gives you a little time, right? Now, I, as a pharmacist, I have made myself available and continue to make myself available to speak one-on-one. If you have doubts, whatever is the issue, I am not judging you. I am just here to tell you what are the options, and you make your choice. But as I said, we don't like the burglar bars, but almost every home in Jamaica has burglar bars because we know we have added protection. So for the vaccine, it's like the burglar bars. We also have the hand washing, the mask wearing, and the social distancing. So let's do what we can to get back to hugging. You know what I miss the most? The hug. My personal experience is that I'm serious. I'm a huggy type. And my personal experience is that I saw a friend who I had not seen for a long time. And we were at the licensing authority to get my license. And I ran to her, ready to hug. And when I realized that I couldn't hug, I cried. And I know a lot of grandparents and a lot of elderly, they are crying because of the lack of contact and the lack of community. So let's get rid of it. We have an option. Let's use it wisely.
Well, lucky for you, you still remember how to hug. I don't even remember how to kiss. And the final person, the woman who I must say, approached me and motivated her executive to get this thing going. And based on the support, I can tell you, if this thing was advertised more, certainly Zoom could not manage, because I think it's nearly fully, you have a few hundreds, I think about 400 or more. So this has gone very well, but I think I think it's being saved. So we are going to put it up, but I hear persons are asking for part 2. We will see how that one goes, because it has not been easy getting everybody together. So let's hear from the president, Dr. Winsome Christie, president of the Pharmaceutical Society of Jamaica.
Okay, Dr. Watson speaking about hugging and all of that. Well, don't get excited. Getting the vaccine will not mean you can hug anyone anytime soon. We have to still wear our masks, keep our distances, and wash our hands, etc., unfortunately. But guess what? It will be less risk of persons contracting the illness. The children won't, because what is happening now overseas, they're finding that the young people are coming down with illnesses due to the Delta variant. So we have to be vigilant. Get your vaccine, take your herbs, take your supplements, eat properly, exercise, keep your mental health, happiness, try as much as you can. And that's what we are wrap up. And thank you very much, Mr. Darby and the team. Thank you.
Thank you very much, Dr. Christie. And as we come to an end of this forum, the rains are coming down, showers of blessings. Let's hope the goodly Father will shower some more blessings in terms of us fighting this deadly virus. And if you don't think it is serious, you have a little cut finger, try and go to the hospital and you see what happens to you. Make your grandmother sick and go to the hospital and you see what is happening. We are in serious trouble, and only we can do it for ourselves. So I make a special appeal to the whole of Jamaica. Let's do what you have to do. Sometimes we can spend our times arguing, yes, arguing, while the place is burning down, while all we needed to do was to get a little fire, a little water, call the fireman and put out the fire. We're arguing what caused the fire, how we are going to out it, while the fire continues to burn down the whole house. And in this case, the whole of Jamaica and possibly the whole world. Thank you very much to the president of the Pharmaceutical Association of Jamaica, Dr. Winsome Christie. And thanks to the panelists, Dr. Lisa Bromfield, Dr. Winsome Christie, Dr. Ernestine Watson, and Dr. Diane Newman-McKenzie. Thanks to the sponsors, the Pharmaceutical Society of Jamaica, Dr. Ernestine Watson, Everybody's Pharmacy, Dr. Winsome Christie, Sunshine Pharmacy, Zoom operator, Miss Gabriella Williams, logistics, Kevar Bennett, producer, Miss Gabriella Williams. I am Vernon Darby, your moderator, saying, your health is your wealth. Walk good, my friend.
Bye.
Bye. Bye.